around the world and into your heart. Coming at you live from the KLDC 1220 AM studios from Mile High City, Denver, Colorado. This is the Let's Talk Live Now show, a weekly discussion designed to open you up to the lost Hebrew roots of your faith. And now here she is, author, speaker, teacher, and mentor, and your host of Let's Talk Live Now, Valerie Denise.
Welcome out there, KLDC listeners. Welcome to this edition of Let's Talk Live Now. I'm so excited about being in your company, being in your midst, being a part of a conversation that I believe only our God and King would want us to have on today's Saturday, the Sabbath day of rest. Today is one of those days that I am so excited about the conversation and the guests that we're going to have on air with us, primarily because it's something that I'm confident you will get more out of than you would expect. Today is going to be a day also where I want you to get involved. You know, sometimes we have those interactive conversations where you can call into the studio with a question or comment about today's subject. Well, you're welcome to do that. So I'm just going to give you that number right off the bat before we jump into anything. The studio number is 303-433-8000. Many of you know that. Let me do as I traditionally do, or as often as I remember to do, and that is to ask you, how was your week, KLDC? How was your week? Were you a blessing as well as a recipient of the blessings of our God and King? Sure you were. I'm sure you shared a smile, shared a thought, shared an emotional moment with someone. I hope you've been praying for folks, because I've been praying for you. Well, let's get started with today's show, and let's talk live now. I want to introduce today's guest. His name is Dr. Stephen Haymon, and this gentleman brings a lot to the table today. Our subject matter specifically is right on point. It's about post-traumatic stress disorders and all the different areas or capacities that stress may relate to. And our guest today, Dr. Stephen Haymon, literally has profound work on the subject matter. And of course, it comes from our God and King. So before we get started, and before Dr. Haymon comes onto the airwaves and properly gives us a little bit more of an introduction of who he is and what he brings to the table, I want you to go tell someone, KLDC, you know, if you're getting something good, you got to let other folks know about it. So go ahead and let someone know that you are tuned into Let's Talk Live Now. And here we go. Listen, I want to say to you and to anyone else that may be catching it live or are doing so from the archives, that this is the place to be. So with that on the table, KLDC, please welcome to the airwaves, Dr. Stephen Haymon.
Hello, Valerie. How are you?
I'm wonderfully well. Thank you for coming to the show, Dr. Haymon. Tell us a little bit about yourself and your background.
I most certainly will do that. If you don't mind, I just want to tell you, I love the Denver area. I've done a lot of work in Denver area as well as in Colorado Springs area. So when I come into your neck of the woods, I just get ecstatic the beauty that God has bestowed you all in that area. I do understand about the fire, but be that as it is, let's talk about Stephen Haymon, Dr. Stephen Haymon. I'm a psychologist. I have been for 40 years. I've done individual therapy, family therapy, marital therapy. I've worked a lot with depressive disorders or mood disorders. So I deal a lot with depression and bipolar and affective disorders and things along those lines there. And I've worked with individuals, marital couples, families, and children. And so I have a doctorate in educational psychology, a master's in social work, and a bachelor's in education. And so I didn't choose this route for me. God chose it even before I knew this is the route I was going to go in, because after I got drafted in 1969 after getting out of the service, what I ended up doing was pursuing school in the aforementioned manner that I did. And one of the first jobs I had was working for Veterans Hospital under the chemical dependency unit, treating the individuals coming back from the Vietnam War. So that's a little backdrop of who I am. I tell people 40 years experience does not top that I am a man of God, meaning that I'm a spiritual individual, and I want to please Him in every way I possibly can.
We love the sound of that. Thank you, Dr. Haymon, for that introduction. KLDC is grateful that you are here, and as am I. Post-traumatic syndrome, I want to jump right into this, Dr. Haymon, if we can, primarily because there are many folks that are coming back from current day's war, and we're hearing more about this post-traumatic stress disorder and all of its different tentacles. It has the capacity to really debilitate people, and I think that we take for granted stress and the many disorders. Give us a little bit of an idea from the clinical perspective. What exactly is stress, as well as, of course, post-traumatic stress disorder? Talk to us about that.
Okay. Stress, first of all, exists everywhere, whether it's bad or good, whether we get $1 million or we're broke, whether we're on the top of the mountain or in the valley. So it's there. It's not so much it's being, it exists. It is our perception of what's going on, and our bodies react to our perception of what's going on. So if we're going to combat it, then we have to change our perspective regarding stress. So as the resistance of stress, we encounter the resistance of stress, what we end up doing is reacting to it. So it expedites the aging process. It makes us susceptible to all opportunistic conditions. It affects not just us, but the people we interact with, our wives, our children, people on the job. And a lot of times when we're dealing with stress, the thought of it, there are feelings associated with that thought, and so we look for distractions to mitigate the effects of the stress, which really doesn't resolve it. When we talk about PTSD, which is post-traumatic stress disorder, it is a deeper form of stress. It's a trauma that occurs to people. It can occur to women who have been raped, children who have been maimed or shot, or watching someone get shot in the neighborhood. And what it does, it has a residual effect on the person. And the person, although they're no longer in that situation, they're reacting to it in their minds and in their hearts. And so it can go like, and there can be things like fear and paranoia and hypervigilance and inability to sleep and crying spells and projection and those kinds of things. So post-traumatic stress is trauma that anybody can care. But when people go into the wars, they're watching people getting killed. They're killing people. They're destroying people. They're destroying. They're watching their colleagues getting maimed and things along those lines there. And that's contrary to the upbringing of most people, because in the rearing environment, we teach people to be loving and caring and sensitive and not to work ill towards people. And yet and still, when they go into war, they orientate the person to kill, destroy, and you got to survive. So the being thrust into the environment where you can see people, you're walking over bodies, you're smelling the stench, you're watching people, homes and things getting destroyed, or you're watching people getting shot up or cut up or something like that. It's pretty traumatizing for individuals. And so essentially, that's what stress and post-traumatic stress is.
Thank you, Dr. Haymon. I'm listening and I'm just revisiting so many different opportunities, I guess you could say, where I've seen it on the face of people. With Katrina, helping out with Katrina when that happened, and the face of the men and women and children that were traumatized for that. Something I want to say, there are two items here I want to cover very quickly with you, Dr. Haymon, if we can. One of the things is, that biblically speaking, that we have, from the Hebrew perspective, which is where I come from, we tend to kind of follow what we call this pattern of behavior, where the scripture says that we have a city of refuge for those who have gone out to war and that sort of thing, or people who have, in essence, had traumatic stress situations where they flee to that. It was called Goshen at that point. And one of the things that I want KLDC to get from this conversation between you and I is that they have a place, a city of refuge to run to when they're dealing with this stress, when they're trying to understand different anxiety disorders. You know, Dr. Haymon, you have a book out that I want to give away to a listener before we close the show today. It's called Stress, Climbing Out of the Pits with God. Let's delve into that a little bit. As a city of refuge, let's be able to explain how this book can help people who are dealing with these many disorders and never knew what they were called. What's one of the first things we should note that could be considered a disorder relative to stress, Dr. Haymon?
First of all, can we talk about a city of refuge as it relates to us individually? And when God comes into our lives, He bestows upon us the concept of holistic, meaning that we're not in this world by ourselves. And many times we can get caught up from a religious perspective that I'm holier than thou. I can quote a few scriptures. I've been in church for a little while, and so what I say is right. But when we are really submitting to the will of God, we are our brother's keepers. And so many times, because we don't understand what depression is, or stress is, or post-traumatic stress is,
or what it looks like on the face of people.
Like, we are really not sensitive to these individuals.
Exactly.
And that's contrary to God, because we are indeed our brother's keepers, and we're supposed to be sensitive. We're supposed to be caring. We're supposed to be loving. We're supposed to be non-judgmental. We are supposed to love our brothers, because that is a commandment that God says. He says, "Love me with all your heart, all your soul, and all your might, and love your brothers as your neighbors as yourself." And we don't do it because we don't understand the concept. Only God can empower our minds to do that. Now, I believe that we're supposed to have a place of rest, but it starts with us as individuals first. See, if I approach you, Valerie, and I say, "Look, I'm hungry," and you said, "Well, I'm going to pray for you," well, you're not really being sensitive. If you have $5 in your pocket and I'm hungry, or you have some food to share with me, isn't it your reasonable service to minister to my needs? Because that's the reason why God put us here. And so He saved us, and He's empowered us to minister to the needs of others, no matter what status in life that they are. So we have to start with ourselves first, and how we view ourselves. And one of the things, the book that you're talking about, it talks about, it serves as a mirror so we can really see what we're doing and how far out of line we are to the will of God. In Acts 13:22, it talks about David, the son of Jesse, was a man after my own heart. Well, he said that in Chronicles. He also said that in Samuel. But in Acts 13:22, it says, David, the son of Jesse, is a man after my own heart. He will do everything, not some things, not most things, but everything I want him to do. So once we get this concept in our minds that we're doing the will of God, then it's not about us. It's not narcissism, or it's really about how am I living a life before people that they can see God in me and seek refuge,
and
not
run to
in me, but in Him. So the book serves as a mirror for us, but it also serves as a reflection so we are able to read other people. We personify well. I can tell you that I got it going on, but what is my body language? What are my eyes? What is my behavior and attitude conveying to you? And the book allows us to be able to read other people so we can minister to them.
Dr. Haymon, listen, I'm glad you're here. We're going to have to take a very quick break, so hold on tight, KLDC. We'll be back right after these commercial breaks.
Struggling with your mortgage payments, not knowing what to do. You do nothing. But if you do something, you're far more likely to get the most positive outcome. Making Home Affordable is a free government program. Call 888-995-HOPE to talk one-on-one with a housing expert about your options. Call 888-995-HOPE or visit makinghomeaffordable.gov. Brought to you by the U.S. Treasury, HUD, and the Ad Council.
Confusion over someone or have sudden...
Have you ever had sudden confusion, trouble speaking, or understanding someone?
It could be one of the 5 signs of stroke.
Sudden weakness or numbness of the face, arm, or leg.
Sudden trouble with vision in one or both eyes.
Suddenly having trouble walking or difficulty with balance.
Or a sudden intense headache that comes out of nowhere.
Don't wait. Call 911 immediately.
Time lost is brain lost.
Find out more at powertoendstroke.org. Brought to you by the American Heart Association, American Stroke Association, and the Ad Council.
You know that the ice cream scoop can make a child smile, and that by slowing us down, the traffic light can keep us going. You know that the lawnmower makes life easier, that the blood bank makes life possible. But did you know all these ideas came from the minds of African Americans? Support the United Negro College Fund, because a mind is a terrible thing to waste. Visit uncf.org or call 1-800-332-UNCF. Brought to you by UNCF and the Ad Council.
And welcome back, KLDC family. Whether you are streaming in live on the World Wide Web at 1220kldc.com, or you're picking this up on the archives on my website at lets-talklive.com, or you are right in the Denver metro area, tuned in on your AM radio dial at 1220. No matter, you are in the right place at the right time. So listen, Dr. Haymon, let's get back to where we were in this discussion, shall we?
Yes, ma'am.
I have a question for you. You know, it's something that you brought up just before the commercial break. We were talking about, in essence, managing stress with the power of God. And I threw into the subject matter this city of refuge and all that it plays. And in our modern day world, not only physically or geographically, we are that city of refuge. In your book, Stress, Climbing Out of the Pits with God, Dr. Haymon, you kind of give us a roadmap of how the face of God looks in dealing with these issues and how to help people. Let's talk about some of the names of these illnesses that people may not be familiar with. I think people may hear stress and they're not really clear. I mean, is it schizophrenia? When I look this up, there's like a whole bunch of different categories. Let's give some warning signs to people out there before we go any further. Can we do that, Dr. Haymon?
Oh, absolutely, absolutely. Because I think it's important for us to be able to identify what stress is and some of the symptoms, so we can understand, or at least we can assess exactly what's going on with people. So let's do that right quickly, and then I want to address, if you allow me to do that, I'll address some of the topics in the book that really talks about some of these things. But people who are experiencing stress or depression, because it leads into other affective disorders or mood disorders, they seem to have a depressed mood most of the day, and they have a disinterest in things that they normally would be doing, and so they avoid people. And then there's either they're eating too much and they're not eating at all, or they're experiencing insomnia or hyperinsomnia, whereas they're sleeping too much. And then there's either psychomotor agitation or retardation, where people are reacting to everything, or they seem more lethargic and out of touch with things. And there's the fatigue, the lethargy. There's a sense of worthlessness that's going on, the inability to focus, concentrate, and to even remember. But the bottom line is, when people are stressing, they're not themselves. Now, understand this. They can't see it because they're in the middle of the forest. They're in the middle of it, so they can't see it. So they're thinking that they're acting normal, and other people are sitting up there seeing, and they're seeing what's wrong. Of course, now, it's not happening to me. It's that person's issue. Then they need to address it, and I don't need to address it. We only address it when someone goes into the office and then they shoot up the office because it seems rational and sensible, rational and sensible to them that they've done this. Their reasoning ability, their cognitive ability has been impaired. So one of the things that we really need to do is to watch people, particularly particularly people who have gone to war, people who have experienced trauma, people who are experienced losses,
Yes,
whether a mother, father, brother, sister,
or even divorce,
divorce. Those are grieving things. Anything. So we're looking at the person, we're looking at the temperament of the person, and we're detecting that something is wrong. Because if it's not addressed, a person can go into depression. If it's further not addressed, it can go into severe depression, and then depression that they call a nervous breakdown, which is depression and psychosis. And here the person has a difficulty in differentiating between fact and fantasy. But all of us can be subjected to this because we may have genetic predispositions because our mother, father, grandmother, uncle, or aunt have experienced depression, bipolar, or schizophrenia or something like that, and we don't even know it because we tend to bury this. We don't want people to know that we have skeletons in our closet.
Wait a minute, Dr. Haymon. Wait a minute. A lot of us culturally, and I'm going to say this, even religiously, would defy that there's no such thing because, God forgive me, the blood of Jesus, and I don't have that. Well, I beg to differ with you folks. This is a very real issue, and there's nothing wrong with you who has it. It's wrong with the people who deny that you have it. So, Dr. Haymon, continue with that if you would.
Yeah, and I would tell you, because I travel the country, I go to the different military bases, I go all over speaking, and people will tell me I'm too blessed to be stressed. I'm too blessed to be stressed. Yet and still, they're eating, they're going to pornography, they're
angry, they're bitter.
They're doing everything,
yes.
They're going to distractions to mitigate what they're feeling, and they're not accepting the fact that they're not operating. So they're not sleeping, and they're isolating, yes. or they're very reactionary to things. They're projecting, and so here they are, and I'm talking about good Christian people. Joyce Meyer said years ago, just because you go to church doesn't make you a Christian. And she used the analogy, just because you sit in the garage doesn't make you a car.
Doesn't make you a car,
because
yes.
God is the one that's determining our walk with
yes.
Him. And the more we seek Him, we go to Philippians 4 and 6, where it says, be anxious for nothing, and let your requests be known in prayer and supplications, and the peace of God that surpasses all understanding will guard your heart, mind, in Christ Jesus. Well, He's the only one can impose it, but it comes with a cost. That cost is seeking His face, not to be judgmental. Well, I heard that he did this or she did that. That's being judgmental. We're supposed to support one another, particularly our military people who have been
yes.
thrust into war. And when I say the military people, I'm talking about anybody who has experienced trauma. If anything, we're supposed to be sensitive, caring, kind-hearted, and patient with these individuals. So what we attempt to do in this book that you talk about is that we attempt to equip people or empower people to combat it with themselves, but also to be supportive to the people who've experienced stress and post-traumatic stress.
Dr. Haymon, give me one thing we should be doing right now relative to some of those clues you've given us. Give me one key element or step that I could do right now when I leave this studio to help someone who may be dealing with stress.
First of all, let them know that anybody that seeks help, they're not weak. In fact, they're strong. In fact, I tell people all the time when they come into my office, they say, well, I just don't want to be crazy. If you were crazy, you wouldn't be here because crazy people are not even aware that they are. So you have to be supported. Sometimes we need encouragement. A lot of families I see, they're coming in with their husbands, they're coming in with their wives, and the reason is because they have identified something else. Once the person gets help, and I struggled with for years because I've been in church 62 years, on and off, but particularly in the last 35 years. And my pastor is a bishop, and I had to say, look, I'm not trying to take your job. I have been equipped. I've been trained. I've dealt with this. And so what we want to do is empower people to really walk as closely as they possibly can. So we want to be supportive to people. We want to encourage people. If you got a shot in your arm, you don't say, well, God is going to heal the shot. You're going to go to the hospital. So I'm saying when you're hurting like that, let's support the husbands and the wives and the children and the grandparents and the nieces and nephews and uncles and aunts to get help from an adult, clinical, spiritual person.
Yes, yes. We're talking to Dr. Stephen Haymon out in Missouri. I hope I said that right.
Yes, ma'am. Yes,
we
ma'am.
are so excited about this dynamic conversation. And please, please, please check him out on greaterinsight.net. He has a book that I'd love to give away to the first caller at 303-433-8000 before we shut down today's broadcast, which will be closing in a few minutes. Dr. Stephen Haymon, I would love for you to give me one final thought. If there was something you could change about the paradigm of stress or these disorders, what would that be? Very quickly.
I would say it's not so much what's going on, but how you look at what's going on. So you have to change this construct of your thinking on things. See, I'm a firm believer that God allows things to happen in our lives either to correct us or to build us or to carry us into the next phases of our lives so we can draw people. So if we change the way we look at things as opposed to complaining and bickering about what's going on in our lives, let's look at ourselves and see how we need to grow.
Awesome, awesome. I'm going to close with this thought. First, before I do that, though, Dr. Haymon, it has been an honor and a privilege to have you on the KLDC airwaves. We appreciate you so very, very much.
Thank you.
Let me give you all a closing thought that I thought was kind of close in connection to today's program. And it's just this. It's given to us by Sidney Madwed. And the quote is this: every goal, every action, every thought, every feeling one experiences, whether it be consciously or unconsciously known, is an attempt to increase one's level of peace of mind. This is your girl, Valerie Denise. And remember, KLDC, it's always about the human connection. And I bid you and everyone around you grace and peace.
Thanks for tuning in to Let's Talk Live Now with Valerie Denise. If you like what you heard, we hope you'll pass along our web address, www.lets-talklive.com, to your friends and colleagues. Be sure to take a listen to the archives on our website for previous segments. This has been a production of the Let's Talk Live Company. Join us next Saturday, 1:30 p.m. Mountain Time for Let's Talk Live Now.